Shared decision making is something now that's called for in the clinical guidelines, and as an international alliance of patient organizations, this is something that we're very keen to embrace. The evidence is there that when patients are involved in the clinical decision making process, they have better outcomes, and it makes for a better overall patient journey. So we're absolutely delighted to be here today launching the report on shared decision making.
Shared decision making is a bit of a culture shift in the way we do healthcare. It is around really making sure that the patient's voice is included and prioritized in how we achieve a good treatment decision. So it's an invitation for patients to share what matters most to them, but it's also a dialogue with their clinicians so that we know what is the best evidence available to support them, and how can they then make sure that the decision that we reach with them is the right one for them.
We need to treat the valve, we need to treat the disease, but first, we need to treat the need of the patient. And I think it's very, very important. And you talk about the education of the patient. I think we have to talk about education of physicians in order that they must understand this very, very important problem.
So we heard loud and clear from our physician colleagues that they need support to learn more about how to do this. We also heard from patients how important this is to them to not only achieve a great clinical outcome, but also to achieve a great outcome from their perspective so that they feel really comfortable with their treatment decision and that they feel like they were heard and that their priorities were taken into consideration.
It's really important for patients to feel supported, to feel informed, and to equip them with the knowledge that they need going forward in relation to valve choice. It's about that collaborative working with their clinician to support them to come to the decision that best suits their lifestyle.
The Global Heart Hub Shared Decision Making Roadmap is a very, very useful tool. It's a collective international voice of patients explaining what a collaborative decision conversation is to get the best therapy leading to better health outcomes. And what we can do is implement that locally by looking at decision aids, the patient preparedness, so that they can get the best out of those in-person treatment decision appointments.
The shared decision making is one of the big things of happenings in cardiovascular medicine, which is going to change the practice. Implications are grave, and I'm very honored and privileged to be part of this journey with Global Heart Hub.
Really excited to be here, and we're meeting with Global Heart Hub as part of this exciting initiative. The roadmap for shared decision making is really important. We've known for a long time that heart team decisions make better decisions and better outcomes for patients. Having the patient as part of that team is integral and something we've usually missed. Patients need the ability to have a say in what they want, and what is best for their quality of life is something that we need to start focusing on going forward as part of our lifetime management.